about 20% of Nigerians and 70% of Ghanaians have health insurance. 8% of the United States are uninsured with out-of-pocket visits averaging to thousands of dollars annually for hospital stays.
Hi, I'm Ruthie. I recently visited a public hospital in Ghana as a Nigerian. Today, I want to show you the common comparison and differences between public hospitals in Ghana, Nigeria, and the United States. This comparison is based on the pricing, the treatments, and the general environment of the public hospital.
Hey, yeah, let's see how you do under pressure. Oh, yeah.
My favorite part of the morning is when I'm on my balcony and just chilling with my cup of coffee. I have a cup of coffee every morning, and I got this bad habit from my dad, and my dad is in his 60s and I don't know if he still drinks coffee. I'll ask him today. I'm trying to not be late to work, so I'm trying to wrap this shit up so that I can get to work at 8. So you're basically spending my morning together as we gist about healthcare. In Nigeria, patients hustle through crowded clinics with no beds, no power, paying $10 to $50 out of pocket because no insurance. This teaches entrepreneurs to create solutions with limited resources.
The United States public hospitals excel in technical quality but lag in equity, which means low error rates but high costs. Ghana edges Nigeria in outcomes like lower maternal mortality of 308 versus 814 per 100,000 births due to better funding. 7.6% of Ghana's budget versus 5% of Nigeria's with NHIS success. Nigeria's system is more fragmented with higher corruption and strikes disrupting healthcare.
I got a job recently as a chef in a restaurant, and this is 6 a.m. and I'm on my balcony, and usually I enjoy my mornings better, but today I actually have to go to work. Ghetto. Having a job is so ghetto. And so for US hospitals, they have cutting edge high tech but high cost, over $1,000 plus for uninsured visits. Entrepreneurs therefore have to plan ahead, like securing insurance. Overcrowding and infrastructure strain hospitals in all three countries. They struggle with high patient volume relative to capacity. In Nigeria and Ghana, facilities are often dilapidated with inadequate beds and unreliable electricity and water, leading to unhygienic conditions and delays. The time is 7:40 and I'm right on time actually. I'm almost late, but I'm literally right on time for my first day. Wish me luck.
Yeah. Yeah. Yeah.
Yeah. Hey.
Yeah.
Hey.
Yeah. Tell him, bro.
Yeah. I'm staring in the mirror at the
Ghana's NHIS covers 70% of people, and communities support each other in the clinics. As a Nigerian, one thing I always say is like Ghanaians are such a community-oriented people. They are always open to help each other, open to help even strangers. So that's one of the traits they have. That's, even though healthcare is not really favorable, that trait of community that they have, it helps and goes a very, very long way. As a Nigerian visiting a Ghanaian hospital for the first time, one of the
cultural shock I experienced was how easy and accessible healthcare is for them. They can literally dial a code from their phones using their Ghana card and then they can access it. But as a foreigner, I paid 80 cedis for a hospital card and over 300 cedis for a series of routine labs on my first visit. And even though the rates are terrible and in comparison to the Naira, these are very, very high costs.